Minister, thank you for coming here. By the way, the more you keep highlighting the urgency of the situation and the crisis that has arisen from that situation, the more you reveal your failure in doing your job. Because your job should have been to prevent it from reaching to that level. Your job should have been to manage this crisis before it got to a crisis level. Your job should not have been done by Parliament. Only you are taking pride in the fact that Parliament had to step in and do your job for you. So in your statement, in the initial statement, you say, after I was made aware of the situation on December 5th, we started taking immediate action. And then you tell us that you had a conference call with suppliers on December 10th. 5 days. Is that your definition of immediate, Minister?
Well, thank you for the question, and I would say a couple of things. First of all, I've been a health minister for close to 5 years in this country, and I know the honourable member has not had that wonderful experience, but I can tell you, despite the best laid plans of mice, women and men, there's always something that crops up where you have to respond to a situation that was not planned for. And I can tell you, after you do, and when you respond in the best interests of your constituents, Canadians, there's always a group of people that are saying you did far too much and overreacted, and there's always a group of people who are saying you did far too little and underreacted. That's the price that one pays. But I can tell you I am quite convinced that once we heard that this was an unscheduled shutdown, that it was going to occur to such an extent that it was going to have an impact on supply, we acted immediately. The first thing you do is collect information, and that's what we did. My own personal conversation with one of the European suppliers actually took place on the Saturday, December 8th, not on December 10th, as you suggest, with the CEO of Areva in Paris.
That's what you said.
And indeed, there were many official contacts as well by NRCan on Friday, December 7th, when we learned about the extent of the issue that we faced. So the first thing you do in any potential crisis situation is collect information, and that's what we did. We started with talking to hospitals.
Thank you, Minister.
And then we create a plan.